Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital of Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. Now we're going to talk about hiatal hernia. Hiatal hernia as well as reflux, what is also called gastroesophageal reflux disease. For you to understand a hiatal hernia and gastroesophageal reflux disease, you have to understand the diaphragm. The diaphragm is a very thin muscle that separates the chest from the abdomen. It separates our lungs and our heart from all our stomach and our intestinal contents in our abdomen. Now, the diaphragm in every patient should have a small hole, and that hole is for the esophagus, which is our swallowing tube to go through. But when that hole gets bigger and gets too big, the stomach will rise up into the chest. You see, every time you take a deep breath, that stomach rises up into the chest. Every time you cough, you sneeze, you push, that stomach will go up into the chest. And obviously you can have small hiatal hernias, which cause a larger amount of reflux, or you can have larger hiatal hernias, which are called paraesophageal hernias, that can cause reflux or can also cause problems with swallowing. Now, what are some of the symptoms of hiatal hernias? Well, reflux is one of the symptoms. Heartburn, regurgitation, acid feeling in the mouth. When the hiatal hernias are large, you can get what is called dysphagia, which is difficulty swallowing, because the stomach is up in the chest and it's blocking your ability to swallow. If the stomach is pressured up in the chest, you can get ulcerations and bleeding. And then if the reflux is very severe, you can get burning of your vocal cords and you can get hoarseness and even pneumonia because your gastric juices are going into your lungs. Treatment of hiatal hernias and reflux first begins with medication. You have heard of proton pump inhibitors, the omeprazole medication, and that can be used to decrease the amount of acid. But remember, that's not going to stop the reflux. That is not a barrier. It just decreases the amount of acid. Now, if you have a hiatal hernia that is not able to be treated with medication, if it's too big and it requires surgery, then surgery will be performed via robotic approaches. And I recommend you look at our video with regard to robotic surgery. But robotic surgery for hiatal hernia is through small incisions. It's 4 small incisions. And what we do is we go in robotically and we put the stomach back into the abdomen the way God created it. We close the hole around the esophagus to make it the right size around the esophagus. And we will add mesh as needed to reinforce that repair. Now, if you have reflux, sometimes we do something called a fundoplication, which is take a portion of your own stomach and wrap it around the esophagus to help you with that reflux, to recreate the valve that God gave you to prevent reflux. Now, sometimes we don't take your stomach or you don't have that portion of the stomach, and we will have to use a magnetic sphincter augmentation device. It's like a little tiny necklace of beads that we place around the esophagus to help with the reflux. Now, whether you need mesh, whether you need a fundoplication, or whether you need this magnetic sphincter augmentation is something that I will discuss with you individually in the office when I look at your particular case. These operations are done under general anesthesia. They take about an hour to do. They're done with small incisions, and the patients will stay one night in the hospital. You'll be up and around walking, talking, moving. You'll go home the next day. Our patients who have a hiatal hernia repair with a fundoplication will be on a liquid and puree diet for 2 weeks and then transition into solid food. The patients who have a magnetic sphincter augmentation device, also called a LINX device, those patients will be on solid food immediately after surgery, as I mentioned, to do physical therapy on the device, to keep the device moving. Your activity level is driving within a week, exercise in 2 weeks, and no heavy lifting for 1 month after these operations. Now, with every hernia repair done, the concern is recurrence, or that the hernia can come back. And with hiatal hernia repair, paraesophageal hernia repair, the chance that these operations can fail and the chance that these hernias can come back is around 10% over 10 years. So hiatal hernia repair, paraesophageal hernia repair, and reflux is very common. Reflux is very common in our community, and if you have a hiatal hernia and it requires repair, we're going to offer you robotic surgery. These operations are done routinely within my practice. They take an hour to do, and patients are immediately started on a diet and are out of the hospital the next day. And you go back to your normal activities, and you're on to full recovery within a month's time. Once again, Dr. Anthony Gonzalez here, educating you on another surgical topic. Thank you.